Well, welcome everybody to the GCI Summit. I am Dr. Jeffrey Becker, and I'm the Science Director at Bexson Biomedical. I have a long time history of using ketamine in clinical practice, started about 15 years ago after graduating from residency and practicing in Los Angeles in integrated psychiatry. And I will be presenting today on some of the mechanisms that ketamine has revealed as to how scope of consciousness is kind of controlled in everyday life, and how ketamine and other NMDA receptor molecules can release consciousness and expand consciousness, and also discussing in contrast how the psychedelics work in terms of their mechanism for increasing consciousness. And I'm going to go on a little bit to explain why this is a useful kind of range of information to understand when you're working with patients, how it actually translates clinically to kind of a useful paradigm to work with patients. So just a few things. Disclosures, as I said, I'm co-founder and science director at Bexson Biomedical. I'm a partner at Noetic Fund. I am medical advisor at Neurohacker Collective and a member of the ASKP3 Certification Governing Commission that started recently. And a little bit of background just to give you a sense of the way that I've worked over the years. I've used ketamine for a range of psychiatric indications, treatment-resistant depression probably being the most common, but acute interventions and suicidal ideation, kind of long-standing existential despair, transitional life crisis, complex trauma. I use ketamine as an intramuscular delivery system rather than IV. It is on label for intramuscular use and range somewhere between 0.3 to 1 milligram per kilogram, kind of on average, either as a single bolus or more often really in 3 divided doses. There's, of course, kind of cardiac and pulmonary assessment ahead of time and monitoring. I'm present throughout, and other management if need be, including use of beta blockers or clonidine or ondansetron for nausea. Adverse effects, generally, I've not seen much other than mild increases in blood pressure, some nausea, some dizziness here and there, but mostly manageable. My background is functional, and I work really to look at the 3 layers of human being at kind of body, mind, and spirit. And I've learned to kind of start at the bottom, actually, honestly, and move towards initially inquiry into metabolism, labs that might be making somebody not feel well, not respond to medication generally. And look at genetics as well to assess micronutrient status, detox status, and things like that. So generally, just to give you a sense again of the mode that I use typically is to give an initial shot, take whatever the target dose is, split it into 3, give an initial shot that lets people kind of go into the transcendent space and then come out. And as they come out, sometimes we kind of capture some of the symbolism, some of the imagery, some of the material that they're kind of working through so that we can kind of revisit it later. I have a lecture called Capturing the Symbol, and it's really, I think, this space right here as people are coming out right before the next shot, they go in again, and we do it one more time. Gives a chance, almost kind of a triptych experience in the office, and allows a lot of material to be mined for ketamine-assisted psychotherapy. So just to give you all a little bit of a sense of a way of approaching ketamine use in the office that you might not have seen. I'm going to start here with a poem, and it's a poem that gets at something that we all kind of understand and yet don't kind of understand what is occurring and why it occurs. There's this kind of feeling notion that as we age through adolescence and into early adult development, in the 20s, and definitely, by the 30s, there's this process of kind of losing touch with the child, losing touch with the wonder. There was just a report looking at adults and characterizing the fact that we forget how to play. So there's this decrease in kind of connectedness and creativity that occurs. And it's very much a neurological process, and I'm going to go into it a little bit. But this poem from Wordsworth, Ode on Intimations of Immortality, I think is amazing. It really gets to it, talking about how at birth we come into the world and we are in some ways kind of whole, kind of coming forth from God, and heaven is around us as when we're born. We're kind of in this primary state. But as we grow, the child, the shades of the prison house begin to close. And I think this is, the beginnings of kind of the containment, the individuation, but also the estrangement that can happen from wonder and from awe. And then the youth who goes farther from the east must travel still as nature's priest, is still there, and by the vision splendid on his way attended. In some ways, there's this push out into the world because of a still connectedness to this. And then eventually, at length, that man proceeds to die away and fade into the light of common day. What is Wordsworth getting at here? What is it that we're losing a sense of connection to? If you look at transpersonal psychology that really came out of Jung and a whole bunch of other theorists, and has been kind of expanded upon over the years, there's this fairly clear sense that we live in a kind of duality between the ego and the self, the deep self, the larger kind of more universal aspect of who we are, versus the more individuated, more goal-driven aspect of ourself that kind of emerges out of self. And this is a drawing from Ego and Archetype that I think is wonderful. It shows how the ego is supposed to kind of emerge from self and yet stay connected. You see right here that the ego and self are individuated but connected. This is kind of the idealized state. You can imagine a circumstance where that ego pulls away so far that that line gets strained and gets broken or becomes thready and difficult to gain connection to gain communication from the self to the ego. And vice versa, really, in a looping fashion. These are ways of thinking about what the paradigm might be for what depression is, what it is that we've lost connection to. If you think about the Wordsworth poem, what is it that's lost? What is fading? What is fading in the light of day? There are three kind of primary relationships between self and between ego and self. And from now on, I'm actually going to talk, when I say self, I might interchange the word symbol because they're in some ways quite interchangeable. There's the first one where the ego identifies or merges with self or symbol. This is kind of a primary state, an immature state, a concrete state, can actually be kind of associated with psychosis or kind of some of the more intense forms of personality disorder. In some ways, it's the ego kind of believes it's omnipotent and it doesn't have the kind of proper humbleness that it needs to kind of navigate the world. The alternative is to be completely alienated from the self, to be, again, so separated that communication is not there. And this is more of a state of nihilism and despair, wherein the symbols in our lives become signs without their magic, kind of robbed of their life force. And in some ways, kind of a connection to the mystery is extinguished. The ideal state is where the ego is separate from, but receptive to the self. And in this state, the symbol is then able to perform its proper function as a releaser and transformer of psychic energy. So these are kind of different ways to look at this. And the reason I'm giving this as a background is that I want to kind of show how it is that ketamine and the psychedelics can actually kind of correct this relationship between ego and self. If you think about what might be going on where the ego kind of loses connection to the larger aspect of self, you can imagine why it might be associated with depression. Depression is very much an alienated state where patients feel kind of cut off from some previously available sources of strength within themselves. So what I'm getting at again is trying to really characterize this very difficult, this kind of esoteric aspect of what we are, what we have available to us, this aspect of the self. So I'm going to go through a chain of evidence to some extent here. I've discussed this primary core being lost, and I think at some level it's kind of obvious that if this loss is not regained, then kind of a spiritual despair and a kind of depression can result. I'm going to show you coming up here that this process occurs partly through increasing GABAergic interneuron control over thought. GABAergic interneurons are inhibitory in the way that they work, and they have kind of meta control over thinking, and they grow in their intensity in terms of control over thinking, and their interrelatedness in terms of how they're coordinating with each other in control of thinking very clearly through adolescence and into late adult development. Early adult development through the 20s and 30s. Ketamine blocks those receptors, those GABAergic interneurons that control pyramidal cells, kind of the vast majority of our thinking cells. Essentially what ketamine does is it inhibits the inhibitor and allows awareness to kind of shift from a more stereotyped, kind of circumscribed way of thinking, and I will get into that as well, showing you how the nodes interact to kind of create stereotypes in the way that we think. And awareness shifts from that kind of more ego-based thinking to much larger, more integrated consciousness that might be characterized as self. This process maps very, very nicely on to the descriptions of mysticism. If you look at mysticism within religious studies as a kind of a subset of a subfield, mysticism describes certain characteristics of the mystic state, and they very much map onto what happens in the ketamine treatment experience during the acute effects. And then finally, I'm going to show you a little bit more about kind of come back to this main theme about how this is at some level ego self-access restitution or realignment. Okay, so to go back to this, this is a psychological description or a psychospiritual description. Does it map onto the neurology that we see in the human brain? Here, I'm going to show you a little bit to help you understand when I was talking about pyramidal cells. Pyramidal cells are really in some ways what we would call the thinking neurons. Like when you say, I am thinking, that's in some ways you can say that what you're really meaning is that my pyramidal cells are firing and are discussing material with each other. There's a lot of things that flavor what we think and flavor how we think and flavor how fast we think and flavor the kinds of things that we think. But thinking itself in some ways could be thought of as pyramidal cell activity and interactivity. Now, these are located in many different layers of the brain, and they're very, very interconnected. The pyramidal cells here, to give you a picture, have dendrites that are kind of sampling information, and then a cell body, and it's shaped like a pyramid. That's why it's called a pyramidal cell. And then they have their axons that go out and communicate to other cells. Well, this is what I want to show you that is so fascinating, is that a ways back, there was a neuron that was discovered called the chandelier cell. The chandelier cell, or the axoaxonic cell. And when it was discovered, it was actually quite shocking, actually, honestly, because the way that it works was so different than other neurons that people kind of couldn't believe that this was actually a thing, that a neuron could actually have its axon located on the axon of another neuron. Normally, the axons of neurons either synapse on the dendrites of other neurons. You can think of dendrites almost like long ears that are going out, or hands that are kind of reaching out to feel what's going on out there. Instead, with the chandelier cell, the axon of the chandelier cell, which is inhibitory, has a stranglehold around the early axon segment of the pyramid cell. You can kind of think of it like a tie tied around the neck of the pyramid cell. The pyramid cell may be receiving information from its dendrites. It may be getting information that it wants to send on through its axon, but right here, the ultimate arbiter of whether or not a pyramid cell can fire is whether the chandelier cell allows it to. Okay, quite interesting. What we're getting at here is that the interactions of pyramid cells are deeply and profoundly controlled by chandelier cell activity. Chandelier cells are, again, considered the final arbiter of whether or not a pyramid cell can fire. There's another inhibitory cell called a basket cell, and it synapses primarily on the body of the pyramid cell, and it has a very different function. I'm going to show you how these two things work together to kind of control scope of consciousness.